Hey guys, Jeff Lewis from Lewis Physical Therapy and Sports Rehab in Point Pleasant, New Jersey here. I want to talk to you guys today about one of the more common injuries that are out there for baseball players with shoulder injuries, and that is labrum tear, specifically slap tear. So, what is a slap tear? Slap tear is the tear of the superior labrum from the anterior to posterior portion of it, and it is one of the more common injuries that we see in the thrower's shoulder. Now, I will preface this with saying if you're at the high school, collegiate, especially past the collegiate level, most guys are walking around with a slap tear in the shoulder. If you throw a baseball for more than if you throw a baseball for a good part of your life, you're probably walking around with a slap tear in your shoulder. Not all slap tears are symptomatic. A lot of times they're asymptomatic. So I just want to set the stage with that because a lot of times people think, oh, I have a slap tear. They might not even be having shoulder pain, but if they get an MRI or whatnot, it shows they have a slap tear in there. Doesn't necessarily mean that there's anything that needs to be done right away. So we're going to talk just more a little bit later about more of the treatment options that are out there for it. But with a slap tear, one of the other important structures that we like to talk about is the long head of the bicep tendon, because that long head of the bicep tendon, so again, your bicep, the muscle on the front of your arm here, and then it comes up to your shoulder and splits off into two parts. You have the short head that goes this way and the long head that goes straight up. And that long head, that bicep tendon attaches to that part of the superior labrum. Now, when you throw a baseball, I'm going to talk in the context of pitchers here just because that's who we typically see these in more often. Not that it happens only exclusively in them, but pitchers is typically what we see this in. So with a pitcher from throwing motion, so they make their money getting into layback, getting into external rotation. You'll see guys where they can get their arm almost perpendicular. If I'm pretending I'm lying on my back, they can get their forearm almost perpendicular to the ground because they have a ton of external rotation in there. Now, part of the ability for that motion to happen is what we call the peel back mechanism. So the peel back is as they get their arm into layback, that bicep tendon gets wound up and it literally pulls apart that superior labrum. It pulls it off of the glenoid, which is just where it sits and is attached to the shoulder blade, but it pulls it off of the glenoid a little bit. So by it coming off of it, that frees up more motion to get into layback. And again, for pitchers, more layback is usually means you can have a better ability to use your stretch shortening cycle. So further you go back, more stretch, the more power you can produce for coming forward. It just gets to a point where that labrum at a certain point might fail. You might have too much of a tear in that labrum from the chronic stresses of throwing that anytime you throw, it's going to cause pain. Or the other side of it that certain people think is it's the issue with the bicep tendon. And the bicep tendon has been shown to be a pain generator. So again, a lot of times if you see someone with some type of bicipital tendinopathy, it's likely there's some type of slap tear going on in there, but it's more the bicep that you're focused on, trying to find positions to take pressure off that bicep versus the labrum. Now, that everything we've talked to this point is in the chronic sense due to the chronic stresses on the labrum from throwing. From an acute traumatic standpoint, labrum injuries can happen from traumatic injuries. So sliding into a bag, your shoulder dislocates, or you slide making a diving, or you go to make a diving catch in the outfield, hands first, and your shoulder dislocates. But that's more traumatic side thing. This is what I'm talking about more from a slap tear standpoint. So one of the first questions I get from people when they're told, say they have shoulder pain for however long, they get an MRI, and it shows, oh, they have a slap tear. People around the time are like, okay, well, we got to get surgery right away to get that. If you're a baseball player, and especially if you're a pitcher, again, this is not talking about the context of acute traumatic injuries like dislocations, but if you're a baseball player, especially a pitcher, and you're found to have a slap tear, do not go right to surgery. The main reason being is because what surgery is going to do is if they go in there and they stitch that labrum up, you're essentially going to be attaching it back to the glenoid, and as a result, you're going to be limiting your layback. The hardest part for a lot of guys that go through labrum surgery is getting that external rotation back because you're limiting that peel back. Now, I will say this. There are absolutely times where baseball players, pitchers need to get surgery to correct a slap tear. There absolutely are. I'm not saying there's anything against that. I am more so talking about the approach to get there. You need to make sure that you work with a baseball rehab specialist and you go through aggressive physical therapy. And I don't mean just doing a couple bands here and there. I mean, you are challenging at full capacity, the rotator cuff strength and endurance. I use a ton of blood flow restriction, BFR training with these guys to get that rotator cuff to a better position because they are typically very weak externally and a lot stronger internally. You need to really address any issues along the scapulothoracic area in terms of specifically lower trap serratus strength, getting that shoulder blade moving, getting it strong and stable. You need to look at the thoracic spine. Do they have enough rotation? A lot of times, guys will lose rotation essentially getting into their front foot strike and their ability to hold hip-shoulder separation. If you don't have enough rotation in your thoracic spine, that just means you're going to have to put more stress on your arm to get more rotation back and eventually leading to more power, more stress you have to put on your arm. So after that, then we want to look more downstream. What's their core look? Can they even hold a plank for a minute? Do they have the general core strength they need to withstand certain positions and postures throughout the pitching motion? And then we go down to the hips, the feet, the ankle. I'm going to go back up to we'll stay at the hips though, because a lot of times if you don't have the hip strength or mobility, you're not going to be able to push off the mound as effectively. And as a result, you can't push off the mound as effectively, or you can't accept weight onto your lead leg and properly brace that front leg as you're coming through. You are not going to be able to transfer energy properly from your lower body to your core, to your arm, and the ball. And if you can't do it well with your lower body or your core, well, where are you going to have to get that extra stress from over time to keep throwing hard and get your velo up? It's likely to come from your arm. And then eventually that labrum is going to hit a point where it can't tolerate it anymore. So again, you need to make sure before you go any surgical route for a labrum tear, especially if you're a baseball player or pitcher, is that you go with a aggressive approach to rehab first. Because a lot of studies are out there that show, especially if you're a pitcher, once they put a stitch in that labrum, it's a lot tougher to get back to play. Not that I haven't seen it, because I've seen guys and I've helped guys get back to play after labrum surgery, especially pitchers. But it's a lot tougher compared to other surgeries in the elbow or shoulder or anything like that. And if you do get back, the likelihood of you being the same productive level of pitcher, whether it's getting back to your old velo, command, endurance, anything like that, it's not that high. So that's why we really at Lewis Physical Therapy and Sports Rehab, we take a very aggressive approach for pitchers that come to us after having some type of suspected or confirmed labrum slap tear more than anything. So again, if you're a baseball player, you're dealing with some shoulder pain, you've been told you have a slap tear, and you just don't think the rehab that you're going through right now is putting you in the best position to succeed and get back to play, go ahead and leave us a comment below with any questions that you have. You can like and subscribe